Hello, my dear friends, and welcome. My name is Vickie Hadge, and this is Even So It Is Well. Today, I'm going to tell you what MS is. What is MS? It's that wheelchair disease. No, not quite. In fact, most MS patients do not end up needing a wheelchair. Only about 1/3 of MS patients need a wheelchair at 20 years after diagnosis. So what is it? Let's break it down. Multiple equals many, and sclerosis equals scars. So it's a disease of many scars. But don't worry though, MS does not make you lose your good looks. In fact, many people will say, "Honey, you look so good." It affects the brain, spine, and optic nerves, collectively known as the central nervous system. MS is an autoimmune condition where our immune system mistakenly attacks our own cells in our central nervous system. Mistakenly, like, oops, my bad. Our immune system typically takes very good care of us and fights off disease and infections. But in patients with MS, it gets confused or triggered to attack our own nerves. More specifically, the protective coating on our nerves called myelin. So here's an example of one of our neurons, one of the cells that are in our central nervous system. Y'all have a nerve stuffed animal, don't you? No? I'll put a link in the description below if you'd like to get one. Mine is called Smiling Macy Gray Matter. My friends helped me with the name. The big part is the cell body, and these things coming off it are called dendrites. And this long section is the axon. And then these little tendrils are called axon terminals. The dendrites receive signals from other neurons, and then they transmit the electrical signals along the axons. Did you know that axons can be as small as a fraction of an inch or up to 3 feet or more in length? Fun fact of the day. Then the terminals send signals on to other neurons. These axons are covered with myelin, a fatty sheath which helps with the transmission of signals and protects the nerves. In MS, the immune system causes damage to the myelin, and when it gets damaged, the signals get distorted or interrupted, and this causes our symptoms. Often you'll hear people talk about relapses, flares, or progression of MS. Relapses are periods when we have new inflammation, when our immune system attacks a new area of our central nervous system and new damage is done. How rude. This can present as new symptoms and can sometimes be seen on the MRI scan. There will be bright spots called lesions. After an attack, there can be a period of healing when the acute symptoms may get better or disappear. This is typical of relapsing remitting MS, which is what my current diagnosis is. Flares are typically when already existing symptoms may flare up but are not new. For example, when I get overtired, overheated, or overstressed, I can have a flare of my old symptoms, but they typically settle down over time back to my baseline. Progression is when symptoms get worse and continue to accumulate. They steadily get worse. An MS patient will be considered secondary progressive MS or primary progressive MS if they have steady accumulation of new symptoms. So, what else is MS? MS is one of the most common neurological conditions. MS is more common than you think. 2.5 million people worldwide have MS. MS is more common in women than men by 3 to 1. MS is a demyelinating disease. The myelin gets damaged or destroyed. MS is neuroinflammation, inflammation of our central nervous system. MS is typically diagnosed between the ages of 20 and 50. MS is not fatal, but there can be complications that can lead to death. Most MS patients can lead a normal lifespan. MS is unique to each patient. Because it can affect any part of our central nervous system, we can all have unique symptoms. That's why it's sometimes called the snowflake disease. MS currently has no known cause. MS gets on my nerves, literally. MS has a multitude of symptoms such as vision problems, numbness and tingling, loss of sensation, weakness, dizziness or vertigo, fatigue, muscle spasms, mobility problems, pain, cognitive problems, sexual problems, bladder problems, bowel problems, speech and swallowing difficulties, depression and anxiety, and more. Yes, it's the disease that keeps on giving. What other symptoms do you have? Drop them in the comments below. If you'd like to hear a bit more about my early MS symptoms and MS symptoms in general, you can check out one of my other videos. I'll put a link up above and also in the description below. If you're new to MS, do not be afraid of this list of symptoms, because guess what? MS is also very treatable. If you're new to MS and new to my channel, please subscribe and hit the notification bell so you don't miss any upcoming videos. It wasn't that long ago that there was no disease-modifying treatments, but now there are dozens. And there are many drugs to help us and our symptoms. And there's a lot that we can do to help manage our own symptoms. There are many diet and lifestyle changes that we can make to help support our bodies and perhaps convince our misguided immune systems to behave better. Check out my playlists on lifestyle and food to see more. The question of the day is, what topics would you like me to cover in my videos? Is there something about MS you'd like to know more about? Drop it in the comments below. If you enjoyed this video, please give it a thumbs up, the icon under the video. This will help the channel and help others to find the channel. If you enjoy content on living well with chronic illness and diet and lifestyle changes that you can make to live well with your chronic illness, be sure to subscribe and ring the notification bell. Thanks for joining me today. Until next time, be well.